I'm co-chairing this track E, which looks at issues to do with health systems issues. We look at economics issues, even financing issues are part of that as well, and implementation science as well. This is a very important track where we're actually reviewing a number of abstracts from different countries within the African continent, focusing on issues to do with research that is happening within African countries, and implementation science is very important discipline that helps us as health providers to really learn as we go in terms of implementation and improving in terms of programming. Yeah, so that's an important area. And health systems, as you know, this is also a very important area. And so we're looking at the link between HIV and AIDS and health systems, because HIV programs are implemented within a health system, and therefore looking at the various aspects, the pillars of health systems and how they interact with HIV is a very important aspect. So those are some of the abstracts that we're seeing and including in this conference. So within our track, we've received over 300 abstracts. So these have been scored, they are ranked, and we hope to select about 60 or so, because we're actually putting together 9 sessions within this track. And we received a lot of interesting topics, ranging from issues to do with public-private partnerships, looking at aging and HIV and AIDS, looking at social protection issues, looking at the 90-90-90 targets, issues that are linked to that, looking at use of technologies, the point of care technologies, like looking at viral load, looking at early infant diagnosis technologies. But we've received a lot of abstracts from Zimbabwe. And therefore we hope that Zimbabwe will really showcase how we are responding to the HIV and AIDS epidemic and the successes that we've actually seen in terms of reducing morbidity and mortality, in terms of improving survival of people on treatment, despite a difficult sort of macro environment. So we've been able to leverage on the resources that we have in order to really make advances in terms of responding to the HIV and AIDS epidemic. So we look forward to the conference, and we have different presenters that will be coming, hopefully, to really showcase the work that we're doing. We expect a diverse audience, and from different levels. We expect policymakers to be part of this. We expect people from the academic environments, the universities. We expect program managers and implementers, including the frontline care providers. So we're actually mobilizing resources to ensure that we have participants coming from different levels, all the way down to a health facility in a rural clinic. So we hope that there will be people from different backgrounds and from different parts of the country as well to participate in this. But we also hope that we can get people from the private sector to be involved in this, particularly when we talk about public-private partnerships and how we can leverage on resources to co-invest into health responses. And therefore, we do expect other sectors to participate in other government ministries as well. Well, in terms of selecting the abstracts, we really look at the type of abstract, whether it fits within the particular track. In this case, we're looking at health service delivery issues, we're looking at implementation science and economics. We look at the quality of the evidence that is being presented. We look at the methods that are being used to actually generate, come up with the findings. We look at the relevance of the topic, in terms of how to respond to the current epidemic status. We look at when the studies were done. If it's something that was done 10 years ago, it may not be useful at this point in time. So we look at how up to date or when was this particular study conducted. And we look at the presentation of the abstract itself. And is it coherent? Is it flowing well? Is it something that can be useful when it's articulated to the wider audience? So we actually look at all those issues to inform in terms of whether it's something that is worth being presented as an oral or as a poster presentation.